Skull fractures are basically a break to the cranial bone, which is also known as the skull, and it can be due to the major blow to the skull, which can cause basically the breakage of the bone. So that is basically the trauma. That is basically a direct impact to the skull, which is causing these fractures, and that is discussed in detail over here. Basically, we'll be discussing in detail the forensic anatomy of the skull, first of all, so that you have a better knowledge about the different layers, about the different tables of the skull that are damaged due to the trauma. And then we'll be discussing the mechanism of the fracture of this skull fracture, and how is basically what kind of a blow can cause these fractures. That is very important. Then we'll be discussing the types of skull fracture in detail over here. So there are a lot of types, and but the cause again is the same. It is a blow that is hard enough to break the bone, and even it can be a slight depression can be even regarded as a skull fracture. So we'll be discussing that over here in detail. First of all, if we look at this diagram, it is a very good representation about how the skull injuries occur. Now over here, we are basically comparing the impact of injuries are different over here. If we have a direct frontal impact, that has a different kind of injury. Injury lines are quite different over here. And if we have a quite lowered impact, now, both of these impacts are usually a part and parcel of the RTAs, that is the road traffic accidents, and usually they are observed in the front seat passengers. For example, the driver and the front seat passenger are usually the ones that are hit like this. And now what is basically the kinematics over here? The kinematics over here in the front impact injury, it's basically direct backward, and it's also known as the coup injuries. That is, over here we'll have the contour coup injuries as well, and over here we'll have the coup injuries. Now the skull stress is basically defined through the more blacker portions over here in this diagram, and then we have the brain strain. The brain strain is the slightly grayish area over here. That is basically involved in the coup injuries, that is the front impact injuries again. And the injury types are usually the skull fractures, the contusions, and the epidural hematoma. So these are the type of injuries that are encountered in the impact injury, which is directly to the front. Then we have the contour coup injuries. In the contour coup injuries, it's basically the front impact is over there, but we have the impact on the posterior surface of the brain. And here you can see the skull stress is the light grayish dark area over here. And the brain strain again is lying over here. And the type of injuries are the concussions. The diffuse pattern of the axonal injuries is observed in these type of contour coup injuries. And then we have the contusions. Moving on, we have the subdural hematomas and the intracerebral hematomas. So all of these type of injuries are basically a part and parcel of the skull fractures. Whenever we have a skull fractures, we will be basically have a suspicion of the contusions, of the epidural hematomas, of the axonal injuries and the subdural hematomas, and we'll have to rule them out before excluding anything or before starting any treatment modalities in such a patient. So all of these things basically we have to keep in our mind. Now regarding the forensic anatomy of the scalp or the skull, it's very important. The inner and the outer tables, they're very important. Starting over here, we have this basically the emissary vein, which is basically lying just on top of this bone. Then we have the diploic vein, and moving on, we have the venous lacuna, that are basically the pools of the venous blood. And then we have the tributaries, which are known as the meningeal veins. Then over here, basically, we have the superior sagittal sinus, and the arachnoid granulations are lying over here. Starting off, we have the dura mater, then we have the arachnoid, and then we have the cerebral cortex over here. Over here, we have the pia mater, the falx cerebris lies in between, then we have the subarachnoid cavity over here and the subdural cavity, which is lying over here. So basically, this is basically a diagram which is showing all the venous structures which are a part of the skull. And the arachnoid, the dura mater, and the cerebral cortex, which is lying over here. So basically, if there is a skull fracture, all of these structures can be damaged collaterally. So we have to basically keep all these things in our mind whenever we are dealing with any patient of skull fracture and we are trying to decide the type of treatment modalities he may be needing. Now, the mechanics of the skull fracture is very important. For example, if you see here, it can be an extrusion as well as there can be an intrusion. Extrusion is basically the skull is in this shape, and if we have, for example, a hammer is causing this trauma, then we can have this intrusion. Now, intrusion is basically causing a slight depression over here, and this is basically the hallmark to this type of mechanics. That is, it is basically the intrusion is the basic thing that will be part and parcel of the skull fracture. So we have to consider this intrusion and the impacts of this intrusion on the structures that are lying inside the skull. Now, the force is very important over here. As you can see, all of these, basically there is a direct force over here, it's a perpendicular in direction, and it's basically causing the direct breakage to this skull inner table or the outer tables as well. They can be involved, and the force, the mainstay is the force has to be perpendicular in this case. Now, there is a Pube's rule for the sequence of the fractures. Obviously, if there is a trauma, we can never say that there will be a single fracture. There will be multiple fractures that will accompany. But the Pube's rule is very important. It's basically that the latter fracture will terminate at that is not across the earlier fracture line, which naturally interrupts the cranial distortion which precedes the fracturing. That is happening over here. For example, this is the first fracture and this is the second fracture. So it will basically communicate with the first fracture. It will end up over here at the first fracture. Maybe if the first fracture has not been there, it would have gone past through this line. But according to the Pube's rule, what will happen is that this is the first fracture and this is the second fracture. So we can get a skull, and if we're going to assess what was the first fracture and what fractures basically proceeded through that line, we can easily assess them according to this Pube's rule. There are a lot of skull fractures that we can come across. There can be linear fractures, there can be base fractures, and then there can be depressed fractures. And then we have another variant that is basically the spider web fracture. That is basically a combination of all of these three fractures. That is the linear fractures, the depressed fractures, and the base fractures. So it is basically a combination to all of these fractures. Now, what are basically the linear fractures? The linear fractures basically that we come across are the straight or the curved fracture lines of considerable length that radiate out from a depressed fracture or arise at a distance from the impact area from the bulging deformation. So it's never a clear-cut rule whether it's a depressed fracture or whether it's a linear fracture. They're basically a part and parcel of the game, and we cannot have only a single type in a person. Basically, we can come across more than one or more than two types in a single person. So here is a diagram which is showing the difference between the linear fractures and the depressed fractures. So here we have this linear fracture in which it is basically quite linear in its lineage, and the depressed fractures as basically the whole table of the skull is basically depressed, and that is basically when we say it is a depressed fracture. It's not basically following any lineage, so we say it's a single table of the skull is depressed and we call it as a depressed fracture. So the ring fractures. Ring fractures are basically the fractures that are around the foramen magnum and are most often caused by a fall from the height on the feet. The foramen magnum is basically shown in this diagram. It's this area basically in the skull at the base of the skull, and it's passing the veins and the arteries and the all of the structures. Basically, the brain stem is passing through it. So all of these structures are damaged as well. And basically, it's a part and parcel of these ring fractures. These structures can be damaged whenever this ring fracture occurs. And so we have to consider all of them in detail whenever we come across any case of ring fracture. That I already emphasized on, that the ring fracture is basically caused by the fall from the heights. Although road traffic accidents and severe trauma can still cause ring fractures in a lot of other atypical cases. If the kinetic energy of the fall is not absorbed by the fracture of the legs, it's basically absorbed by this base of the skull and will cause the ring fracture. Pond fracture. Now, pond fracture, first of all, I have to emphasize that basically the infants and the babies are more prone to this type of fracture due to the child abuse. And a descriptive term for a shallow depressed fracture forming a concave pond, it's basically a type of a depressed fracture. So it's basically a part and parcel of the sexual assault, of the child abuse cases that we come across. It's more common in the pliable bones of the infants. So the mosaic or the spider web fractures is another kind of the skull fracture that we come across. A comminuted depressed fracture may also have fissures radiating from it, forming a spider web or a mosaic pattern. So as you can see in this diagram, there is a spider web, a mosaic pattern that is seen on the skull, and it's basically indicating the type of the mosaic or the spider patterns that are formed by a lot of other fractures. Even the linear fractures can be found over here, the ponds, the depressed fractures. It's basically a combination of all of these fractures. Now, it's basically a diagram, it's basically an X-ray, a radiological examination in which we see this depressed fracture. It's basically the inner tables are depressed in such a case. It's a result from a high energy direct trauma, and patients often present with neurological signs. So basically in this section we discussed about the fractures of the skull. We can come across a lot of different types of fractures. Again, the cause is the same. It's basically a blow that is high enough to cause the fracture of the bone. So we come across all of these cases. So that was the end to this section. Thank you for watching sqadia.com.